There's so much going on in the world already. There is a lot of hardship to go round twice or even more. And so the least you can do is to not affect the next person with bad smell. So how can you tell that you have mouth odor? Hey guys, I'm Ruth Kingsley and this is my YouTube channel. If you're new to this page, we discuss oral health, life, and faith. And so please subscribe, turn on the notification bell, and like this video. And if you're a returning subscriber, thank you so much for sticking with me. I hope you've been learning something so far. Today, I'll be discussing a very important issue. This issue is a maintenance. It can ruin relationships, it can ruin self-esteem, and it can even ruin people's impression of you. What is this issue? Take a guess. 10 seconds. Mouth odor. Mouth odor is a persistent, unpleasant smell that comes out on exhaled breath. Like when you talk, when you breathe out, that's mouth odor. There are other terminologies to describe it, such as bad breath, halitosis, or even oral mouth odor. Halitosis or bad breath is a general name, but whereas mouth odor is when it is specifically coming from the mouth. Now, there are types of halitosis, bad breath, mouth odor, and it's broadly classified into physiological and pathological. Now, if you're not science inclined, don't worry. You're breaking it down. Physiological means there are no underlying cause. There is no disease going on somewhere resulting in the mouth odor. Okay, and it's transient and can clear up with time. However, pathological means there is a problem, there is a root cause, and it needs to be taken care of. For physiological, I think most people, even you watching, may have experienced physiological mouth odor. I'll give you an example. When you wake up from sleep, that breath, that bad smell that comes from your mouth, the moment you open your mouth to say good morning, it's very transient, usually lasts until maybe you start talking or you eat or you brush. Okay, now this is because when we sleep, the saliva production is reduced and saliva has a cleansing effect on the mouth. So when you wake up, because the mouth is dry, sort of, the bacteria in the mouth that habits the mouth release sulfur compounds that you perceive as bad breath. Other causes of physiological mouth odor include some food substances such as onion, garlic, also dehydration. When your mouth is dry for a long time, when you open your mouth to talk, it can be perceived as mouth odor. If you're a student who is studying till daybreak or studying for long hours, or an office worker who is working for long hours, always stay hydrated. A bottle of water, xylitol gums, and stuff like that to keep your mouth hydrated and keep the saliva flowing to prevent mouth odor. For the pathological, remember I said there are underlying causes for the mouth odor. The causes could either be from the mouth or any other part of our body other than the mouth. So it could be from the nose when you have sinusitis. It could even be an indicator of a systemic disease. Example, when you're having liver disease, it can be perceived as a particular type of smell in the mouth. A diabetic patient will have burnt sugar smell. A patient with kidney disease could also have halitosis with a specific smell, and so on and so forth. Even people with gastric, esophageal diseases. So mouth odor could be an indicator of a systemic problem, that there is something wrong in your body. Now, when it's from the mouth, strictly from the mouth, the number one major cause of this is the tongue. Get a mirror, take a look at your tongue. The surface of your tongue here. If it's whitish, like whitish coat, that is a very good cause of mouth odor. It can store as much as millions of bacteria and this can give off the bad unpleasant smell that comes from the mouth. Others include poor oral hygiene, people that have plaque. I've talked about toothbrushing, people with poor toothbrushing technique. You just keep brushing aggressively, you're not getting the interdental surfaces of your teeth cleaned out. It can harbor plaque. Plaque is a biofilm that houses millions of bacteria, and this can give off unpleasant smell. When there are lesions in your mouth, this can also harbor a lot of bacteria that could cause mouth odor. And this other category is people with holes on their tooth, pockets in their gum. This is an illustration. If you prepared a pot of food and you covered it, you didn't warm it, you didn't refrigerate it for a couple of days, what do you think will happen? Of course, it's rotting, it will become sour, and it will give off bad smell. That is not far-fetched from what's going on when you have food packing within pockets or within holes, resulting in mouth odor. There is another category of people, we call them pseudo-halitosis. The feeling of, oh, my mouth is smelling. It can be diagnosed after you've seen a dentist, treatment has been done, and you've been assured you do not have halitosis, but you still feel like you have halitosis. Now, that is a psychological problem. And there is halitophobia, the fear of having halitosis. You're so conscious of it. Every little thing feels like your mouth is smelling, even when it is not. That is a psychological problem. There is so much going on in the world already. There is a lot of hardship to go around twice or even more. And so the least you can do is to not affect the next person with bad smell. So how can you tell that you have mouth odor? I don't know, but personally, as a human being, not as a dentist now, I find it difficult to tell people they have mouth odor because I'm concerned about how it will affect their self-esteem, and I mean, it could really piss them off. So how do you tell someone they have mouth odor, or how can you yourself know you have mouth odor? Now, when you are communicating with people and they're trying to take their nose out of your face, you could have mouth odor. Or maybe if you have partners who are being very honest, they could tell you have mouth odor. Also, wait, as regarding partner, someone some time ago told me a very interesting story. He said his ex told him he had mouth odor. He had visited the dentist, done scaling and polishing, changed his toothbrushing technique, and he was told by the dentist he no longer have mouth odor. But the girlfriend, or rather the ex, insisted he had mouth odor. And so it drove him crazy. He kept visiting clinics upon clinics because, I mean, it is his babe. His partner is telling him he has mouth odor. I mean, that's like a very honest review. Apparently, she wanted to break up with him and she needed a good excuse, and she drove him crazy with the whole mouth odor thing. Other than people's review and opinion, one way to know if you have mouth odor is get a wooden spatula, something like this, or you could use anything flat. Scrape your tongue, then inhale. If it smells awkward, you probably have mouth odor. The mouth shouldn't have any smell. When you are beginning to perceive things, then it's likely there is mouth odor going on. Also, you can breathe into your hand and try to perceive it back. Now, if you want to properly check for that, ensure that you're not wearing any cologne, as it could impact on the result of your diagnosis. Okay, it can also be professionally diagnosed by visiting a dentist. Other than subjective tests, there is a machine used to diagnose mouth odor called halimeter. Now, this measures the sulfur compounds in the mouth. This sulfur compound is released by bacteria. Now you know how to diagnose mouth odor by yourself and professionally. In our next video, we'll be discussing how to manage mouth odor, how to get rid of mouth odor, home techniques, professional techniques. So, if you have subscribed, please click on the subscribe button, turn on the notification so you do not miss out. Next week, we are coming to you with the management of mouth odor. Watch out for it. Watch out for it. Do not let mouth odor be the reason your crush doesn't like you.